Okay, I think we can get started. So welcome to today's webinar, How to Elevate an IV Room with Regenerative Services, featuring Jonathan Dunn, CEO of Cerbo, and Kim Look, CEO of MedMasters. We'll be recording this webinar and we'll make it available after the event so you can share it with your colleagues. You're encouraged to ask questions via the Q&A panel, and we will get to those questions after the presentations. Now over to Jonathan to kick things off.
Thank you, Amy. Really appreciate the introduction and the opportunity to meet with everyone today for our webinar. Just going to start off by going through the agenda. So we're going to start off with some quick introductions. I'll give a little bit of background for Cerbo. I understand there may be some people who are unfamiliar with Cerbo and the service that we provide, so I want to take the opportunity to let everyone know who this may be new to about that. And then we're going to hand over to Kim to go into the meat of today's presentation. And then we'll have some time, about 15 minutes or so, at the conclusion of today's presentation for an open Q&A. But as Amy introduced, we do have Kim and myself as the presenters for today. And we're going to start off with really quick about Cerbo. For those who are unfamiliar, we are a practice management, patient portal, and electronic health record software, really oriented for cash-based medical practices, more specifically those who are practicing integrative functional wellness, longevity, and if you have IVs as well, we're the leading tool and solution for those types of practices. The big thing that we do is we help providers reduce the hassle that are commonly found, and we're helping providers change medicine for the better and reverse chronic conditions in many cases. As I introduced, some of the key things that we do, one is the practice management. We have a couple of screenshots just to show visually what that looks like. And if you are interested in learning more, we'll provide our information for you to reach out to our sales team to set up a demo. But starting off is our practice management tool when it comes to calendars. You can have multiple providers at your clinic and see different work schedules on here. We have integrated e-faxing, bidirectional lab results as part of that. Appointment requests are coming through our patient portal, which I'll show also. So this is what that can look like for you. As far as patient charts, we try to put as much information on one page when you're accessing the charts. For different things you'll see here are the encounter note histories, some internal notes for use for your clinics. You can have patient vitals here on the right, subscriptions for payment block and other payment informations that are relevant. Different documents if you want to see labs, if you want to see handouts that have been provided to your patients, any invoices or any other documents that have been uploaded from the patients, you'll be able to access those here. This is our medications block in here where you can have access to do e-prescribing as well as our integrations with full script and whole script if you order supplements through them. And I'll also show a little bit more about what our IV module looks like here as well. A lot of good information that you can see in one location, and a lot of these, as you double click on them, they'll expand for you to have more functionality in. And as far as the IV features, this is what this will look like if you do have that turned on in Cerbo. We have an example here for Myers cocktail of what that looks like, and you can see the different setting and ranges that we have there for that. And some of the things you can do down here is you can have different notes. You can set up frequencies, durations, and add these into your encounter notes when you're working with the patient. And to mention encounter notes, this is what that would look like. We do have chart parts that allow you to save very commonly used text that you may have in there, and you can pull in information from questionnaires as well. As you can see for this example, we have current medications that are plugged in. You can also order labs from this screen, similarly as you could do from the patient chart. You can have suggested actions, which allows you as a shortcut to populate very commonly used diagnoses, lab ordering, and different documents that you may share with your patients to make your interactions quicker once you get to that point of your appointment. You can also add in cost or add in charges as well and accept payments from this window. Then as you sign out here, this will be populated into the patient portal for the patient to view and have for their own records. And speaking of the patient portal, this is where an example of what this would look like when your patients log in. We do have electronic forms, so those are consent forms or intake forms. All of that will be electronic. We do have a library of forms that you can choose from. If there are any custom forms that are required, you can reach out to our team and we can work with you on what that would look like. But here they can upload, they can do secure messaging. You can have payment methods filed and saved on here for they can be saved for checkout. As I just mentioned, questionnaires. They can view labs. They can view any supplements, update vaccines, allergies, their preferred pharmacies, and then the visit summaries, which would be uploaded to the patient portal after an encounter. So those are some things that you can see at a really quick high level for the patient portal. And yeah, that's really what I wanted to just lay out there for people who are unfamiliar with Cerbo, know who we are, see some of the screenshots. If you would like to learn more information, please reach out to us at sales, S-A-L-E-S, at cer.b as in Bravo, B-O. Once again, appreciate you taking the time. And now we're going to go to the real fun for today's presentation. I'll hand it over to Kim. So let me do stop my screen share, and Kim, you can pick up the screen share from there.
Hey, thanks, Jonathan. I just have to say, like, it's fun to see Cerbo again from the practitioner side. I first integrated with it about, I don't know, 7, 8 years ago with a practice in San Francisco. And me and another consultant had gone through every type of EHR that was available at the time for our industry. And this was hands down the best one. And we fully integrated it. And now it's the only one that I recommend. And it's for a couple of main reasons. You highlighted them, but that IV space, the cash model, the treatment plan model, the ability to bring in inventory and supplements. And so it's just, and I think you guys have developed along with our industry. You're not new to our industry. So I'm sure there's new places or new companies popping up here and there, but you guys have been here for a while. You get this demographic and you get the practitioners who are using it. So, and the one place I choose to be a patient uses Cerbo also. And so now I've had the experience more recently of using it from the patient perspective, and it's so easy and so easy to communicate, so easy. You see the menu down the side of whatever you want to look at for your visits, et cetera. And you can put your patient education in there too. I just went back and I was like, what again am I doing? So it's a great EMR for regenerative, functional medicine, integrative medicine practitioners. I'm really a fan of it.
Thank you, Kim. I appreciate the kind words.
Yeah. I'm going to share my slides here. Does that look okay, Jonathan?
Looks great.
All right, I would love if you guys would interact with me just a little bit up front. I have been working or building practices for about 15 years. My niche tends to be in the IV space. There's a lot more to it, but it tends to be in the IV space. So by raise of hands or actually in the chat, how many of you currently have an IV space? And/or how many of you currently offer regenerative therapies? That may or may not include the IV space. I'm going to go through several of those. Like I say, I've been fortunate enough to be in the space for a long time, and now we're just really hitting hard this regenerative medicine practice. I've had the opportunity also of working with a lot of money that is coming down the pipe in terms of franchise models and the future of medicine, the future of healthcare. Getting away still from conventional medicine, but I can tell you that when we talk about this title of the future of medicine, it is in terms of regenerative medicine. And I just want to really quickly share lots of those things with you. Some of them you may know, some of them you may have never heard of. This is going to be a quick overview, but I just want to give you that intro. I feel like over the years, I've just become a connector, just like you guys connect your patients with regenerative services, with diagnostics, with education, with new services, modalities, equipment to help better their life and their health. I'm a connector for you guys. Do the same thing, education, training, services, modalities, equipment, products like Cerbo. I'm a connector on the other side of things. So I just want to connect you with a lot of thoughts here, a lot of things. Again, if you don't know about this stuff, if you think it's all kind of maybe cutting edge, but maybe fringe. Maybe there's not as much science to it as you think. You're wrong there. But it is, if you don't start this thought process now and start to integrate this stuff now, you're going to see a franchise doing this on the corner of your street in 5 years. So it's definitely coming. It's definitely needed. It's definitely warranted. It's definitely wanted. And so we definitely, there we go, finally changed. We definitely want to make good practitioners aware of it. So this presentation is for either type of you. If you're brand new to IV therapy, you're just thinking about bringing it in, or you've got an IV space, but you want to see what's coming and build it for the future and even be ahead of that curve, these services still apply. There's easy ways to get into it, and then there's more advanced ways to get into it. But my goal is to show you how to address the causes of aging. So regenerative medicine, anti-aging, reverse aging. This is where healthcare is going. Again, not conventional, we get to be a little bit different, use more modern science, more modern services, and really help people slow down the aging process. I want to show you what that looks like. Get more out of your current treatments by complementing them with regenerative products, and putting together proper protocols, training, and tracking are required to get good results. So always our foundation, especially at MedMasters, I am the CEO, Chief Integrative Officer, all sorts of hats I wear with MedMasters. We always want to focus on safety and efficacy. Our motto is protect the patient, protect the provider, and protect the medicine. Number one rule always is do no harm, and then again, focusing on safety and efficacy. So if you have any concern about the things I say, whether or not they're well-researched, whether or not they are utilized, whether or not you can get them as resources, whether or not they're safe and effective, the answer is yes. I wouldn't be presenting them if they weren't. I also, as a connector, the next question once you learn it about anything is, where do I get it? So I want to connect you with those people too. At MedMasters, we've been training in this specific way since 2014. We've trained thousands of providers on a lot on ozone and ultraviolet blood irradiation. If you're here from my group, then you know that. But definitely on a lot of the IV room implementation. So we've helped over 108 or 820 clinics grow. I've personally administered over 20,000 IVs, so I've had a lot of experience. I'm not a provider, but I've worked in clinics and been able to administer. Even if you run into me in a conference, I'll give you as a provider an IV. But over 1 million therapies administered through us, and we've been working with at least 20 countries integrating this stuff. So we've been growing and love what we do. So the 3 secrets to doing regenerative medicine in IV space. Number 1, you got to have the right power tools, right? You got to be able to address natural and epigenetic factors in aging and build treatment plans. Number 2, treatment plans. You got to have services, treatment plans, and then get results. I want to share some of the results that you can get with this medicine. I'm going to go so fast. I hope it sinks in a little bit. I'm glad this is being recorded. You guys can go back and watch it. And then building the IV room of the future includes enhancing the staff training, getting that competency together, and then patient engagement. So what are those power tools? First of all, I just want to compare a little bit. Some of you are probably really familiar with this, but regenerative medicine versus conventional medicine. So healing versus management. Regenerative medicine's aim to heal regenerative tissues, potentially offering cures, hate that word, but something like that, whereas conventional medicine often focuses on managing conditions and alleviating symptoms. So you guys know that. That's why you're in this space. We do it different. Regenerative medicine, like I said earlier, is able to focus on current science. Conventional medicine's at least 20 years behind. So there's so much new out there. I love Google Scholar. If you haven't discovered that yet, I love it. It will pull up more of those current studies. Regenerative medicine can also address chronic conditions as well as slow down the aging process, which includes those conditions. Cost and accessibility, that's one of the hesitations a lot of practitioners find with this stuff, is it's a cash model. It's something that your patients have to determine is valuable to them, and they'll spend their discretionary income on it. But it is very different than conventional medicine. And if you're doing chronic disease or you want to get into anti-aging medicine, these services can do both. And so a lot of you are even into aesthetics. And some of the natural aesthetics are also what's coming in the next year or 2 or 3. You're going to see that. So if you do aesthetics, you definitely want to bring in this stuff too. So we're definitely using regenerative medicine to revolutionize modern healthcare. It's simple. It's utilizing the body's own repair mechanisms to heal tissues and organs. And there are several approaches to this. I'm only going to go over some, but stem cell therapy, tissue engineering, biomaterials, that's bioidentical materials. It focuses on healing and regeneration at a cellular and molecular level. I have a great practitioner friend, Dr. Noel Williams, who says to all the providers that we teach together with, he says, you've got to go back to your medical school days and think about cellular biology. In order to use regenerative therapies, you got to go back to how the cell functions, the Krebs cycle, the electron transport chain, etc. And that's where this focus is. That's what makes it so fun and much more natural. So the treatment goals are to restore function and structure and potentially treat the cause of these underlying diseases. And we'll go through that too. So what causes aging? And this is how we address this. Poor lifestyles, stress, toxins, poor sleep, etc. I'm not going to go into that today, but there are so many very cool kind of biohacking things that will address that. You definitely want to bring that into your practice. I could talk about health coaching and so many of these other modalities for a long time, but I'm going to skip over that for now. The other thing is an imbalance between oxidative stress and antioxidant resources. This one is huge for regenerative services. Every single thing I'm going to talk about today is going to address that. Senescence, that's another big one. I don't know, I've been hearing about it 5-6 years. The studies are finally starting to catch up. Huberman, Ben Greenfield, they're all talking about senescence. There's primary and secondary components to that. But look, epigenetic dysregulation, DNA damage, telomere erosion, mitochondrial dysfunction, cell signaling, these chronic inflammation. This is where if the body is not efficient at senescent recycling, then it starts to damage the system at a cellular level. Immune system dysregulation, mentioned that, and protein folding is another one, how efficient the body is with that. There's tons of studies on this. And the fun part about this is when you look at the studies, you can use intermittent fasting, high intensity workouts, red light laser, ozone, etc., to actually reverse your biological age. So I have a great friend, practitioner. She's developed a robot and AI. We've got software now. We've got better testing now that can actually say, Kim Look is 47 years old, but based on her lifestyle, her cells, her blood, her tissues, her disease risk, etc., is more like a 24-year-old. So there is, again, testing to be able to say whether or not these therapies are working in your practice. And that is a whole nother really exciting fundamental part of this. I'm going to talk about a few of those companies. So let's go through some of the things that, again, if they're here today, but they are sometimes common in certain areas and sometimes not even on the radar for some practitioners. We're going to call them human cellular tissue products today. They're allogenic at their core. They are derived from a donor. But their mechanisms of action, cell replacement, paracrine effects, scaffolding, and immune modulation. So again, looking at regenerative medicine. In the IV space, there's not quite some great human cellular tissue products, since that's my niche and that's why you guys are here, but I didn't want to skip over it. I love Video Labs. There's some other companies too. Y Biotech I love. But if you're not using these products yet, you definitely need to look into them. They're becoming they're so effective, and they're such great clean products, and they're transforming patients' lives. So again, just looking at the causes of aging and then how you're going to regenerate those, this is one of the tools. Again, not super strong in the IV space, but definitely want to look into it. Like I say, every question, after every presentation, where do I get this stuff? I wanted to throw some of these companies out there. I am not paid to promote any of these companies. MedMasters is not paid to promote any of these companies, but it's the next question. We want to connect you with those resources. Peptides. Peptides I'm a huge fan of, by the way. None of this do I go a day without using human cellular tissue products. Peptides. Let's look at the simple functions of peptides. So peptides can act as hormones. They can be neurotransmitters. They can be enzyme inhibitors, thereby regulating metabolic pathways. They can be antimicrobial agents. They can be structural components, so they contribute to the structure of cells and tissues, and signaling molecules. One of the disease components that we have today is that cells do not communicate well with each other. That could be in terms of function. It could be in terms of, cell cycle. It could be in terms of cellular respiration. So many ways that the cells have to communicate with themselves and with each other. That is something that is becoming such a problem. We're noticing it so much better. So if you look through the functions of peptides, they address all those causes of aging. Again, yes, the laws are changing, the ability to get peptides, how you get peptides, that's an ever evolving door, but MedMasters as your connector has definitely helped to streamline that and make that easier for you. But again, if you're not using peptides, and I don't just mean semaglutide and tirzepatide, like the basic ones that insurance covers, I mean the full gamut of those. There's dozens of them that are so incredible for anti-aging, and also in terms of chronic disease and everything in between. All right, the next one, platelet-rich plasma. Let me back up 1 second. Peptides, nothing IV there yet either, but they go together so well. I'm going to share some case studies with you. They go together so well. You don't have to use both, but they will enhance each other along with that advanced human cellular tissue product. All right, platelet-rich plasma. There are most of you are probably familiar with PRP, but did you know that there are now IV PRP products? TrueDose is one of those. It's one company. There's a couple of other ones that I could point you towards, but they do have a patented system with a lot of research behind it. So platelet-rich plasma as opposed to human cellular tissue product. The question is why and when, and that's a long conversation, but remember, human cellular tissue products come from a donor. These are autologous. So depending on you as a practitioner and kind of your belief system, maybe what your patient chooses to use, autologous might be your choice. So since PRP is derived from a patient's own blood, it is considered autologous. This can reduce some of those risks of autoimmune reactions and so forth. But again, let's look at the mechanisms of action: enhanced cellular recruitment, angiogenesis, collagen synthesis, anti-inflammatory effects. So you can deal with a lot of, again, those causes of aging, those causes of disease at a systemic blood or cellular level. I want to throw in here real quick, you can definitely enhance PRP, whether you're doing joint injections or IVs with ozone. I'm a huge fan of ozone, so I want to throw that in here. But platelet-rich plasma, this is what is coming. I don't know of any. I work with over 5 franchises. Some of them, in about 20 locations, and some of them already have sold 100 locations. That's what I'm saying. If you don't see this in your city now, it's coming. So you want to get on this train a lot sooner and figure these things out, because it's gonna drive business, which is great. It's also gonna drive competition. So you definitely want to start the learning process, the training process, and trying to understand these products and these companies that supply these products. I don't know any franchises right now doing PRP IVs. I know of a couple looking at it, but I also know that, again, the products and the systems are becoming more readily available. This company like TrueDose is growing like crazy. And it's not just in our country. Medical tourism, I did medical tourism. I focused on medical tourism for 5 years, mostly for Lyme disease and integrative oncology. But medical tourism is still, it's been for 15 years, growing at an all-time high. 10 years ago it was there. So people will go other places for it. This is a question too, I'm going to talk about at the end, but if you think patients won't pay, you think that you don't live in a affluent area or whatever, those are self-limiting beliefs, because I'm telling you, these industries are growing and these services are profound. So specifically to the IV room, some of those other things, poly-MVA, it's a patented revised twist on Myers cocktail. I'm a fan of Myers cocktail, right? You got to have fundamental nutrition. But it does support, and there's tons of research there. If you have not heard of this, again, there are very few practices at this point have this. One of the things is looking towards the future. One of the things is looking at causes of aging and disease. Another thing is looking at how to set yourself apart from these franchises, et cetera. So poly-MVA is, like I say, a patented product, and I've been using it for years. It's so versatile. It's IM, it's a supplement, it's injectable, it's IV. The next one is ozone and ultraviolet blood irradiation. If you're from my crew, you know that we've had a huge focus on that. If you're new to it, it's a great start to an IV room. It's a really inexpensive, relatively speaking, start to an IV room. If you have a really great IV room, but you don't do ozone and UBI yet, and even if your colleagues or people around you do ozone, if you add ultraviolet blood irradiation to it, you can increase your results by 30 to 60% and set yourself apart. So circulation, antimicrobial, redox, signaling, cellular respiration. Again, looking at the original causes of aging. Antioxidant and phase 2 detoxification is glutathione. Not as new, but also not as universally used, so safe, and has true anti-aging, regenerative, and aesthetic properties. So a lot of people know about glutathione coming from the Asian countries and some of the trends that they started using glutathione for, but phase 2 detox pathways, vitamin C is phase 1. You've got to work through these detox pathways in order to address that component of aging. So glutathione is another favorite one. Methylene blue, it's a big topic right now. It's a big interest. There are franchises that are doing this, lots of practices that are doing this, but it's phenomenal. Methylene blue, it's become popular for good reason and lots of good research on it. It does affect the Krebs cycle and the electron transport chain, and that redox balance between oxidative stress and antioxidants. I'm going to go through these, I guess, a little bit more. I forgot I've got slides on each one of these, but methylene blue, procaine, if you're not familiar with that, we'll talk about that for a second. Another one that I would advise you to look into if you want to look at the future of your IV space. All right, O3UV. Here's a list. I'm not going to go through it. It's fun to find modalities that can address the cellular problem, the mitochondrial problem, the infection or chronic infection problem, increase circulation, increase optimization, mitochondrial repair, so many benefits to ozone. If you already use ozone, you got to look at adding ultraviolet blood irradiation to it. They're synergistic, and you can poke the patient once, draw blood once, and reinfuse it once and get double the benefit, right? So, and again, it sets you apart. If there are other places in your space doing O3UV. Now, the advanced version of O3UV is EBU. Raise your hand if you've heard of EBU, extracorporeal blood ozonation and oxygenation. This is where the future of IV spaces is going, but it's already founded. It's already growing rapidly. It is an advanced O3UV, but more efficient or intelligent form of O3UV. It may or may not have the UV component, depends on the device you buy. But I just want to show you here how, if you haven't heard of it, or you think this is maybe a trend, it's not here to stay, or you have questions about it, like, the numbers are real. Just with MedMasters and our team, we've trained or placed 160 machines, 36 countries, all 50 states. There have been 16,000 procedures completed. We're getting enormous amounts of data on this. It is a high efficacy than other O3UV treatments. Same concept. Again, it's so efficient though that you can get one of these instead of 30 of the others. So in terms of efficiency, in terms of time, in terms of resources, for you and your patients, this makes more sense. And this is what the athletes are getting. With Damon John, he's got a video on it. I saw Dave Asprey just posted another video on it. Danica Patrick. I mean, LeBron James just posted his, I think, is DIV. But this is where, again, the anti-aging, chronic disease, all the way to anti-aging and everything in between, this is where ozone UV is. This is what you want to get in your IV room. So fewer treatments are needed there. Methylene blue, real quickly, the benefits. Electron transport chain. So it bypasses 1 to 3 phase of creating ATP, goes straight to 4. So it can, and it's absorbed really, really quickly in the tissues. So it's definitely something that it can help the body restore mitochondrial function, create that energy. It also donates and receives electrons both. It's neuroprotective, acts as an antioxidant, antimicrobial agent included, specifically with so many practices using it for UTIs. It's got cognitive benefits, works on tau buildup, etc. It's phyto excited. That means if you expose it to the UV light or red light, etc., it generates even more energy. Super safe, super phenomenal. New bio age is my favorite for them. They have an oral product if you don't want to get into IVs, but again, if you've got an IV room or you want to start with an IV room, this is a 1 ingredient IV that checks all the boxes. So definitely want to start to compete with that if you've got an IV space or you start an IV space. I'm here working in locally with a practice who they do aesthetics and they do primary care. They really want to get into this, but right now they are so much in terms of insurance and that whole debacle. We're going to start with 1 IV, and it's going to be methylene blue. It's so inexpensive, so broad spectrum, so easy to deliver, 30-minute IV, almost no side effects. Now, I didn't put all that stuff in these slides, so you do really need to get proper training on these. That's what MedMasters does, actually. But you know, there's more to learn than what I'm sharing here with you, is what I'm saying. But these, I just want to give you that 30,000-foot view so you can look at what you might be able to add to your practice. Procaine. I don't find a lot of practitioners who are really well educated in procaine. They need to be. Is a geroprotector, which is all of these are in terms, but this one actually has research on it. Affects root cause of aging and age-related diseases. Nervous system reset. This is why I have this in any practice I do, and what I do on my weekends makes me sound like an addict or something. But fight stress, fight or flight, dysregulation between that autonomic or parasympathetic and sympathetic nervous system, right? So many people are dealing with that. I don't know of any other IV that's going to address it this way. If you do ketamine, it's very similar, but procaine has a much safer, it has a higher safety profile. And it's super inexpensive. Again, one ingredient, one IV bag, really inexpensive. You can make this and provide this for $10. There's also a lot of other ways to use procaine, neural therapy, injections. I would encourage you to get that trained as well. Again, so inexpensive and so effective. Pain relief, it's an anesthesia, so that makes sense. Anti-inflammatory effects, vasodilation. But what it talks about in the research is protecting against cell damage. It also acts as an antioxidant and also is cytoprotective. So again, looking at the causes of aging and disease, procaine checks a lot of those boxes. So those are the basic ones that I wanted to review today. I love this image because, you know, we can do so much in practice. You can, even in regenerative, integrative, functional medicine spaces, we can fall into the habit of putting Band-Aids on symptoms just with a different source, right? Supplements, you know, even IVs can be used in that way. So you definitely want to look at baking your cake before you ice it. So a lot of things that people do in practice, they're, again, kind of Band-Aids, they're icing the cake before they bake it. You got to look at the fundamentals: microbiome, internal terrain, cellular efficiency, mitochondrial health, and then those other ancillary things are going to work so much better. And again, you can't skip over diet and lifestyle, but that's hard for behavioral change, right? That's hard a lot of times to get people to make those changes, and can take longer to see the results. When you step people into peptides, human cellular tissue products, PRP, IVs, those types of things, it can give results much quicker, which can then encourage that engagement from patients. There's so many modalities out there that can do that more effectively now, and then get people to a place where they have less pain, more energy, sleep better, and then they can make better lifestyle changes. So want to share just a few crazy, again, I could talk about case studies forever, but I did want to share a few of these. First of all, though, in order to get your case studies, you've got to be tracking, right? You got to be able to get a baseline and then be able to say, well, is this stuff working? A lot of the hesitation in this space with practitioners is there science to support it? And then how do I know it's working? Because some of the research is new. Some of it we haven't been doing for a long time. You don't have that foundation of pharmaceuticals and conventional insurance backing that maybe you had in your earlier days of practice. So there's so many ways to do this. I didn't get a chance to make this slide complete, but P&OE is a service. It's a equipment company that has the ability to track, get baseline, and then track if the supplement's working, track if the peptides are working, track if the IVs are working. So 23 biomarkers, it can measure metabolism, fat burning efficiency. And it's not just P&OE. If you got InBody, if you've got Sika, if you've got DEXA scan, right? You want to look at those, measuring those components that actually are the most common causes of metabolic dysfunction or disease or death. And we've got better technology for that. Is it in the traditional insurance model? Not usually. But P&OE is one of those. Again, biological age, muscle strength or mass, like InBody or Sika, that's what they're doing. Bone density and mass, oxygen utilization. Every cell requires it above all. Cellular hydration and function. We presented a peptide course a month ago now. And Leonard Pastrana is one of the owners of New BioAge, and he came and presented, and some of the data that he has seen. He also has some private practices. Some of the products he's building into it. Cellular hydration is showing enormous potential in terms of aging. Heart and lung, right? Those are some of the biggest issues or cause of disease. So you want to be measuring those things, get a baseline for where people are at, and then let them know that the things that they're spending their hard-earned dollar on, cash on, the things that they're coming in weekly for your practice for are actually working. So diagnostics is a big tool here. It's not just the services you provide, it's the growth and the current research in diagnostics. That's just one of them is Pinot. I threw out some of those other brands. I wanted to have them on there, but you definitely want to figure out how to bring in some of those tools. Pinot is great because they've got the whole thing built out for you, although it is not an inexpensive system. So you definitely got to look at it. All right, now case studies. Just really quickly, I pulled some random ones over the years. 6 standard ozone and UBI treatments. This is a practitioner who put this together, who I helped put this together with. She did 6 treatments. You can see the ozone dosage there on the right. And then you can see how C-reactive, I didn't have time to get into particulars of this patient, but C-reactive protein, as you know, is one of the general and incremental markers of inflammation, systemic inflammation. So you can see how she went from in December of 2022 into January. So this is 2 months from 7.7 down to 0.90. And that was huge for this practitioner, huge for this patient. She took this case particularly actually and presented it to the Mayo Clinic because this patient had been seen at the Mayo Clinic and had done all the regular stuff and couldn't get benefit. Here, I just want to share one of these infographics we have on EBU. 2 years ago now, I helped conduct 2 phases of studies on EBU. We have got so much more experience now. But one of the biggest things here is GFR. It's not on here. GFR, kidney function, is actually improving by about 20%. Every practitioner who sees those numbers says, I don't know of anything else that can do that. So kidney function. Again, it's inflammation. Reactive protein is also coming down by 14%. Inflammation overall, those markers coming down by 135%. If you can see at the bottom, these are the results this is the feedback the patients are giving us. Mental clarity is up by 60%, energy is up by 60%, drive is up by 50%, sleep quality up by 60%, digestion, pain. This is an emphatic tool that you definitely want to look at bringing into your practice. So what if you take ozone and UV plus methylene blue? We had this case study. You can see pre and post labs here, 3 treatments of O3 UV and methylene blue. Remember, that's a great combo because methylene blue is excited by the UV, even though individually they could have a great result as well. But you can see LDL definitely came down a substantial amount. Total cholesterol also was reduced. And look at that small LDL. Total dramatic changes with this patient. Is high cholesterol one of those precursors and metabolic challenges in 80% of the population? Yes. What if you put O3 UV and methylene blue and glutathione together? Here's another one. This was a thyroid patient. Pre and post labs, you got TSH coming down by 100%, 50%, however you want to look at it. Free T3 stayed about the same. Free T4 definitely making some changes there as well. So this, I just, again, wanted to share some case studies to encourage you to see some of those changes. And in this case, some of these were as little as 3 treatments making dramatic improvements in those general lab categories. And then if you looked at the EBU, how people respond and how they feel, which is just as valuable. Again, when you approach the causes of things, not just the causes of diseases, like we've got a lot in functional medicine, integrative medicine for mold, for Lyme, that chronic infection is definitely one of those, and it's huge. But look at the people like us who are high functioning. We just want to live well longer. And so it's we still have our genetic components. We still have our stress and our toxic overload or exposure. You can't be human in 2024 and not have that. So it's just, that's where it becomes anti-aging, keeping those telomeres as long as possible, keeping the cells functioning and communicating as well as possible, and keeping that mitochondria pumping out the right amount of ATP. So great news for you if you integrate the right tools and the current tools, right? Like IV Trends are, there's so many franchises and practices that are still back in Myers cocktails and variations of that, and the hangover IV bags, and hydration's important. That is absolutely true. but you want to elevate to the next level or even start at the next level. If you're new to this, you can start with this stuff. That's what I would do. I would start with these basic single one ingredients. You don't have to learn all the pharmacology laws. You don't have to have hoods and all this other stuff to the same degree. It's a much easier, meaning, and also less expensive place to start if you want to start an IV room. And that could be all types. If you want to do a mobile, you want to do corporate wellness, whatever the case is. All right, the last thing, the third secret, building that IV room. So you got to enhance your staff training and you've got to have patient engagement. There's a couple very specific ways to do this. At MedMasters and even just Kim Look, being everything from staff all the way up to owner of practices, I've owned several. There's this real challenge with practitioners who learn the information, they understand the modality that they're using. Oftentimes they can afford to purchase it, but the implementation falls apart. And so that is one of our main focuses at MedMasters. I want to make it one of your main focuses. So education and train is super critical. What are the reasons to train? Going back to our motto, protect the patient, right? Safety and efficacy do no harm. Protect the provider. You guys are kind of out in the fringe doing this stuff, right? And that's one of your worries. You definitely want to make sure that you are well trained, your staff is doing things the way that they're supposed to, and that your patients are happy so nobody gets hurt. Yeah, that's a strong word for this type of medicine, but so they're not unhappy and disgruntled and they make claims and they end up going to the emergency room for different reasons. And then now that comes back on you and the spotlight's there. We want to protect you as providers. And then to protect the medicine, because most of the stuff is either not FDA approved or it not conventional, not insurance based. It's also got its negative connotations coming from the conventional space. So any one thing that goes wrong and it can really ruin it for everybody. So our goal is to protect the medicine here too. So reasons to get proper training. You need that physiological understanding of therapies. That's why I say, don't just look at my slides and say, I'm going to order some Procaine and mess around with it. Like get true training so you understand it. Calculating doses, that's really important. We see that challenge all the time. Accuracy and safety. You can be the provider. You might have mid-level staff that are implementing this stuff. You've got to have your SOPs. You've got to have your consent forms. You've got to have all those implementation or onboarding services or pieces in place to do this well. Efficacy, competence, and confidence, they come together, but they're not exclusive, or can be exclusive, but confidence in your staff and your patients. Liability and malpractice, that comes down to protecting the provider. Standardization is another one. How do we standardize protocols when all you've got is studies and literature to look at, and all of them might be varying? Ozone's like that. Like it goes back centuries, but the research is all over the place. What do? We standardize that for you. We can help you with that. Troubleshooting and critical thinking. It's one thing to follow a process and a procedure. It's something else to use critical thinking on when to cut that off, when to change it, when to assess it differently and so forth. So you want to have those A+ skills so that you can guarantee your implemental success. Again, we see so many providers, the breakdown happens once they bring it into their office. How do you talk about it with your patients? How do you get your staff trained? How do they feel comfortable with it? If you can't, really hit the mark with that, these therapies won't be successful. And the biggest reason why is because you will not see those outcomes that I just shared. You've got to have staff education and implementation, meaning everybody, and then put it into good treatment plans so that the patient can actually get the results I spoke of. Any one of these therapies might have miraculous one treatment effects, but you really have to learn how to put them together. You got to learn the dosages, etc. And then you got to be able to present that to your patient in a way that they can consume, in a way that they can understand, in a way that they can feel comfortable and confident with, so that they can sit back and get the benefits of it. So I just want to remind you of a couple things when building a treatment plan. I say this all the time. It's really insightful. It is a practitioner's job to make the best recommendation, not to determine what the patient's willing to do. So if you have these limiting beliefs on my patient can't pay for it, my patient won't pay for it, my patient won't change their lifestyle, my patient is too sick, my patient doesn't understand it, it takes too much, all those things, that's not up to you. Your job is to present the best treatment plan, the best treatment options based on your understanding of them and the research and services available to you. that is the joy. That is what brings me joy in sharing this with you, is there is better options for humanity than what conventional medicine has to offer. It's your obligation to find those and to share those with your patients and let them choose how much money they're going to spend, how much time they're going to commit to it, and at the pace that they're going to go. So don't lose sight of that. Don't let your perception of people or perception of the area you live in or your perception of your own lifestyle and so forth be what makes the judgment call there. Put together the treatment plan in the ideal setting, present it, and work backwards from there. So yes, present your best case scenario. I'm always saying, if this is me, if this is my mom, if this is my husband, this is what I would do. And it does cost money, but this is what could potentially get us the best results. And again, then you can work backwards from there based on what resonates with them or based on their economic status and so forth. But do what's going to benefit the patient first. And oftentimes, most of the time with every therapy you're brought in, it's going to be more than one, and layering them or stacking them is going to get you the best results. So create treatment plans, packages around how you want to treat for best outcomes, not what you think your patients can afford. And yeah, everybody's got their limits, but what determines those limits? It's generally understanding, it's generally knowledge, it's generally looking at, these are cellular repair mechanism tools. They're not band-aids, they're not medications. We can get you off of those things. We can change the future of your healthcare by using some different mechanisms. All right, I threw this in there. It gets a little bit complex, but here's an example of a treatment plan, a regenerative treatment plan. This has been recorded. Again, I know you're not going to grab all this right now, but this is, again, what MedMasters helps you do. Taking these, stacking them together, figuring out what those doses are, treatments 1 through 12. What does that look like? You need to do this. If you recommend one therapy here and there to your patient, you will not see the results. And then it gives the medicine and it gives you a bad name. Something like eBill in and of itself is great, but it gets much better and much safer when you couple it with hydration, with Myers cocktails, with methylene blue. It makes it work better and faster. And I would say that the fallacy in limiting yourself from what you present to your patients, the ethical dilemma I have there is they're wasting their money and time if they're not given the full picture. So if you're charging them only $300 for one IV, it's not ever a waste, but it's also a waste versus saying, you know what, to get real outcome, you got to do this, and it might cost you $3,000. Me as a patient, I'd rather be told the full picture. Give me the option. Let me see if I can come up with the $3,000 because I definitely don't want to expect something more out of $300 than it's going to give me. Definitely don't want to waste it and not see the outcome. So I do a ton of coaching and consulting on those concepts, the psychology of patients, the psychology of you as practitioners, and how to put that together. Because again, you can have all the great tools, education, go to all the conferences, even get your staff, get it into your office. But if you can't take it to the end, with your patient, then it's not going to be near as effective, and you won't, honestly make the money that you could from it. So this might be overwhelming. Don't let it be. There's a lot of tools available. There's a lot to learn. There's a lot to know, but it is exciting. It is transformative. And so you may just ask yourself, what holds you back from making these changes? Because the overwhelm is only a piece. Then you got to create the steps to get there. Oftentimes it's time and money. If you're thinking, okay, well, how do I learn about this stuff? How do I purchase it? How do I teach my staff? This is all going to take me time and money. Of course it is. But there is a strategic way to do this. And I just gave you just a handful of things that you could bring in pretty inexpensively to really transform and also start. So is it worth it? Is it worth thinking about, how do I do this? Can I set aside the time and money? Of course, that's what we do at MedMasters. We're here to support and serve this process to you. But is it worth it to your patients to look at what the future of healthcare is in terms of diagnostics and treatments and outcomes? And actually, the exciting part here too is we can actually address the comorbidities, the morbidities in 100% of the population, which means you're never going to run out of patients. You're never going to run out of options. You're never going to run out of potential benefits. And so, in my opinion, it's totally worth it. It's totally worth looking at this. So don't allow those self-limiting beliefs. You don't know where to start, what it'll cost. Is it just a trend or is there science? I promise you that there's a lot of science. There's tons of feedback at this point, clinical outcomes here. Maybe you don't have the staff, maybe you don't have the space. We can work through it. You can start with one simple thing, 1 day a week. There's ways to do it, but just think about what's his name say? You're right. If you believe you can or you can't, you're right. And so those thoughts really affect the outcomes here. But this is a thought process. This is a psychology for your patients as well. Their thoughts towards their health, towards the services and the health care that they're able to get, become their belief system that then turns into action, habits, character, and their behavior. So you've got to go through this process with them and with yourself and with your staff to get them to really believe in what they do. And when they believe in that, they will have good engagement, which means good outcomes. Compliance is a huge thing in there. And then also, they'll share it. They'll share it with others, right? Your practice will grow organically because they will share it with their friends and family, post it on their social media stuff, and it will grow knowing that there's other services available to their friends and family through you. So, at MedMasters, I wanted to offer this to you. If you're new to any of this, we can help you with so much of this, but I wanted to give to the people listening here today a bunch of free materials, and I chose ozone and UBI. Again, I thought about methylene blue, I thought about glutathione. I'm like, I'll start with ozone and UBI. So we've got these services available. We do teach on ozone UBI, we do teach on EBU, peptides, and regenerative IVs, and we even have a regenerative aesthetic course. I will partner with Lexley U there. Peptides are partnered with 8 practitioners there. So definitely practical information, scientific information, science-based information there, but we do teach on all this stuff. You can go to our website. This is the free slide here. If you go to medmasters.org/Cerbo, for all the people listening here, you can fill out a form and you will get delivered in your inbox an intro to ozone UBI recording that I've made. So it gives you an overview more in depth than what I did here. It's for all levels of staff. So again, if you're interested in it or you want to expand it into EBU, go fill this out. You'll get this video recording and you can see if it's a right fit for you. Also, I included 2 procedure demos. So there is standards. There's so many ways to do ozone and ozone UBI IVs. There's at least 3 different tiers. So I included some demonstration videos for you on how to do the IVs. You can see that again to assess it. See, is this something that we might be able to bring in? Is this something that we might want to do? And you can kind of get a flavor for it there. I also included, we do full spectrum. We do everything from the education all the way to the implementation. So all the way to the patient's experience. So I included some patient education handouts on what is ozone and the power of light. Those are UBI. So you can see some of the didactics. You can see what that mid-level hands-on procedure looks like in your office, and then you can see how do we talk about this with patients. So it's a translation, right? The technical stuff's too much for them. Translation to how this is going to benefit them. I'm giving you that information for free. If you go to medmasters.org/Cerbo and fill out the form, we'll send it to you. You can share that with anybody in terms of the link to get the free information. Please have them go that route versus sharing just the information. So that way we can service them. If we know about them, we can help connect them and serve them. So anyway, here's my contact information. Well, I don't ever give out, not ever, but you can contact us at info@medmasters.org, or you can go to our website. We're in the process of revamping and so forth, but you can go there to learn more about us. I think I went over time, even though I was trying to talk so fast.
Yeah, no, great job, Kim. I really appreciate it. Thank you, Jonathan. We have so many questions that have come in at the webinar during the webinar that we probably can't get to all of them in the time allotted. So I'm just going to pick a couple, and then I think what I'll do is I'll have you, Kim, and Jonathan follow up on the questions that were directed at each of you. So first question that came in, did you say that you combine ozone with stem cells and PRP in the same visit, the same site, and possibly the same syringe?
Yeah, that's a loaded question, obviously, but there are ways to do it. There are ways not to do it as well. Are you talking about exosomes? Are you talking about stem cells? Are you talking about PRP? With PRP is what I was mentioning. With PRP, ozone, there are research to show that ozone actually activates or excites the growth factors there, and so you can yield a higher result if you choose to do that autologous form of growth factors. And so, yes, in terms of systemic, yes.
Okay, great. Another question came in. I haven't had poly-MVA in a long time. Used to get it from Inazo, but I believe they stopped making it. Where do you get it from?
I'm working on that a little bit further, but drug crafters in Texas, they make it. You can go straight to poly MVA, but if you go there, you have to filter it for your IVs. It's super easy, but it's a step. And I'm working with Texas Star to get them. They're working on getting it soon. Probably in the next couple months, Texas Star will have it.
Okay, great. Thank you. Can you point us to any recommended protocols for some of these IVs?
Yeah, MedMasters. Yeah, there's a lot to that. So what I've done is I break down each one of those things, procaine, glutathione, whatever, do all the didactics on it, then give you the research and literature on it, then help you build those treatment plans and packages with it. You know, what are the dosage recommendations, and then the breast, which is the SOP, the consent forms, the patient handouts, the chart notes, etc. So any of those topics, we definitely do that. There's a couple other great places too. I love Paul Anderson, if you want to go there. In some of the IV groups, IV association, they do some training on some of those too, like glutathione and methylene blue. New BioAge is another one. Like for their stuff, New BioAge on methylene blue and peptides, you get into their back end, and that's one of the main reasons I love them, is because they're educators.
Okay, great. Okay. Yeah, and where can we go to get more information and support? To MedMasters, obviously.
Yeah,
And that free resources site that you just pointed out.
let me say one thing, Amy. There is a link on the website. I'm trying to remember where it is, but you guys, anybody can schedule a 15-minute consult to talk to us and figure out what your needs are, and we can guide you from there. Maybe we have the answer, maybe we don't, but again, we want to connect you with stuff. So there is an option to just get on our schedule and find out information that way.
Okay, great. New BioAge does not ship IV injectables to the Carolinas. Do you have another resource for IV meth blue?
Vertisis is out of Arizona. I do have their information stored, but I don't memorize which states all these places are in. But Vertisis also provides a good non-toxic methylene blue. You got to be careful with that. If you're asking, I hope you know that, but methylene blue is not always safe to inject. It's got to be the right compound.
We're getting a little bit of feedback that the medmasters.org/Cerbo link isn't working, but I know you're going to be sending a follow-up communication.
Yeah, and I'll make sure it is working.
Yeah, and then if we've been doing ozone UBI, can we get info on another therapy?
Yes. Message us at info@MedMasters. And yeah, tell me what you want. And I'll hook you up.
And it looks like the website is loading. It's just it's been slow for some people. So
Okay, good.
with that, I guess I just wanted to ask Jonathan, do you have any concluding comments? Kim?
No, I just want to big shout out to Kim for putting this together. I always learn something when I have an opportunity to sit beside her on a virtual webinar and hear her talk about her breadth of expertise in this space. And really, from conversations, even talking with Kim in advance of this, we're all aligned with making sure that we're putting resources out to our providers who are in this space to be successful, because if you're all successful, we're all successful in this together, in these modalities, which are not very commonly used. And so just want to make sure that's the main takeaway from this, from my perspective with Cerbo, is that we want to make sure that we're putting resources out there for everyone to be successful.
Absolutely. Couldn't agree further. And I appreciate your collaboration with that. Absolutely.
All right. Well, with that, I think we'll conclude the webinar, and we'll be following up with everyone who participated today. Thank you so much.
All right. Thank you.
Thank you.